opening today is a tribute to the fallen, but it is also evidence of hard and constant work put in by those who have formed the committees over the years of preparations. A hospital is not judged by its exterior looks. It is what goes on inside that counts. And as good results are obtained in the smallest places as in the largest.
This simple yet poignant message delivered by Sir Ernest Weary Dunlop at the official opening of the Numurkah and District War Memorial Hospital in April 1957 had a powerful and lasting effect in shaping the legend behind the town's health service.
The hospital was dedicated as a memorial to those who had given their lives at war and to express the gratitude of the people for the freedom that had been won. It was with this strong and proud foundation that Numurkah and District War Memorial Hospital served its community, carrying those same values and beliefs to its present day.
In the 55 years since that official opening, Numurkah District Health Service, as it is known today, has experienced many triumphs, challenges and periods of change. And as the hospital now embarks on a major rebuild and an exciting new era of health service provision for the district, that original message still holds fast.
A hospital is not judged by its exterior looks. It is what goes on inside that counts.
The idea of a war memorial hospital at Numurkah was originally conceived during the Second World War, and in 1945 a provisional committee was formed to raise £15,000 toward the construction of a 30-bed public hospital.
The town was already provided with a fine memorial erected after World War I, but the committee felt that a utilitarian building and service would be more suitable. Also, the town was only serviced by a private hospital, and as the town and district was expected to grow, the committee felt that a 30-bed hospital would be adequate for a considerable number of years. At the same time, the Charities Board was busy planning Victoria's hospital needs, and it considered that a 46-bed hospital with provision for development was more in keeping with the expected population increase at Numurkah.
The work of the Provisional Committee continued for a number of years, and in 1947 a block of land in South Numurkah, upon which the present hospital is situated, was donated by the Moss, Trengrove and Holmes families.
4 years later, in 1951, plans were drawn up for the construction of a 2-storey building designed to accommodate 50 beds with the provision to expand to 70. These bed numbers were calculated on the basis of 9 beds to 1,000 population ratio, utilised as the planning guideline for that period. Around the same time, the Provisional Committee purchased the Penzance Private Hospital for £5,200, and the 16-bed facility was used as a midwifery ward. During the building of the new hospital, a service was maintained at Penzance by tenants of the committee, but this scheme did not work well. In 1955, the Provisional Committee itself was superseded by the District Hospital Committee, one of whose first tasks was to reorganise Penzance.
Plans went ahead with the new hospital project and it was decided to erect a nurses' home prior to the building of the hospital, which would provide accommodation for workmen engaged in the main project. It was a Bristol building of aluminium construction that was imported and set up on a concrete base in the eastern part of the land. Some of the rooms were only 8 foot wide and we had to knock out walls to make wards.
The hospital program went ahead. Architects produced plans for the main buildings and tenders were called. The lowest tender of £430,000 was eventually recommended. In 1955, as a result of a state election and a change of composition of the government, the Hospitals Commission was changed under the new Health Minister.
The Commission examined the hospital building program in Victoria, and it was decided that any project not actually under construction should be held up to allow time to examine alternatives. As a result of this decision, it was determined that the existing plans at Numurkah would not be realised, and that the nurses' home in the Bristol building was to be converted into a community hospital. A plan was produced converting this building into a hospital of 17 medical and surgical beds, theatre, nurses' quarters, kitchen block and an administration.